people say my emotions are like a light switch. They're like on or off, or they go from 0 to 100.
Yeah.
Anyone could be able to kind of create a dimmer system so they know how to dial down if they need to and when they need to. And this is like very teachable. It doesn't matter how many years you've struggled with this.
This is basically teaching yourself, you will be okay. This moment will then pass, right? And just like kind of shifting your energy or your focus somewhere else.
1 P is the paced breathing, which is the 5 in, 5 out. The second P is progressive muscle relaxation, like tensing and releasing, like from your forehead to your mouth, to your neck, like shoulders.
By the way, we have a really amazing clinical psychologist who wrote a book called Stress Resets. Her name is Jennifer L. Taitz. I don't know why I said the L. Does anyone ever say that?
No one says that. And everyone calls me Jenny. So you're welcome to call me Jenny.
Okay, I'm going to call you Jenny. I love that. My dad used to call me Jenny. And we're just talking about the fact that you become blind. Well, I said that you become blind in your mid-40s if you had 20/20 eyesight. And so she just told me that there are eye drops for that. I had no idea.
I saw it in the New York Times a couple years ago. Again, not sure. I have not tried them, but worth looking into.
Totally worth looking into. All right. So I have Dr. Jenny. How about that? Is that okay? Dr. Jenny. There's Dr. Becky now. There's Dr. Jenny, who's on the podcast today talking about her book, like I said, Stress Resets. And I think why I gravitated to this is what I love about this book. It's like a coffee table book. I love the types of books that you don't have to commit to sitting there and like really having to like read it hours at a time. It's done in a way that you can turn to any page and just get like a great thing from it. Like the first thing from the first page, which is not how you have to do it, but I saw about like emotional regulation, which I want to talk about. I want to start with emotional regulation and how important it is to regulate your emotions, because it's like kind of, I feel it's become like a big topic now. And they say if you can figure out a way to regulate your emotions, it like is one of the best stress reducers in your overall like longevity. Is that accurate?
Yeah, I think emotion regulation is like the key to getting your goals done professionally, interpersonally. Good relationships all hinge on your ability to manage your emotions. And the thing that people don't realize is this is something that anyone could learn. A lot of people say, my emotions are like a light switch. They're like on or off, or they go from 0 to 100.
Yeah.
And what I truly believe is like anyone could be able to kind of create a dimmer system so they know how to dial down if they need to and when they need to. And this is like very teachable. It doesn't matter how many years you've struggled with this. We all have tools within us.
Well, this is what I like to do on the podcast. This is what I was going to even finish and further say is that I like when people get like actionable tools that they can automatically implement, right? And so this whole your whole book, I feel like really gives the ownership and the onus on the person, and gives the person a tool or tools where they can in real time try to fix whatever stressor they're having. And if you can kind of break down or some easy tricks or ways people can start to try and regulate their emotions, because I feel like that's really, like you were saying, is where it begins and ends. If we can really figure out a way to kind of hone that, it will help in every way.
Totally. And just getting back to the format of the book, just really quickly, and then we'll get to emotion regulation.
Absolutely.
I designed this because, like, I don't know about you, but the only time I usually have time to read is like when I'm on vacation.
Barely even that.
Yeah. And who has time when they're stressed to read a book about stress? The whole concept seems ironic and comical. And
it's true, right? By the way, just on that, do you know, like there's a book called for people who have ADD, and when I went to the I thought I had ADD, which I probably do. She says I didn't. She actually gave me a book called, do you know that book? Like she said, you have to read this book on ADD called something to distraction. Like it's
Driven to Distraction.
Driven to Distraction. I'm like, how do you expect me to read a book on being distracted when, I can barely even like move from A to B without being distracted, which is exactly why this book is great. Nobody has an attention span. Forget about being on vacation only the time. Like the truth is we're becoming like such gnats where if it's not given to you in a bite-sized, easy way to take a piece of information, people just don't have the ability anymore to do it.
Totally. And I want people like even, people that are in therapy forget these things in the moment. And so to have like practical tools, almost like a cookbook or like a quick like instruction manual for tough moments is so easy to, so this is fully research-based. Everything I say is rooted in science. There's a pretty long reference section, but
and you're like a legitimate behavioral psychologist. I wouldn't have you on if you were just like some girl with a shingle on your door.
Thank you.
Right?
Thank you. Yes.
I try not to have
board certified and all this stuff.
You are. Where'd you go to school? UCLA, right?
I'm on faculty at UCLA. I'm an assistant clinical professor in psychiatry, volunteer clinical faculty. And I went to school in New York and I did my fellowship at Yale. And but my whole thing, my whole shtick, and the reason that I'm here is because I feel like so many people today are struggling, and people shouldn't like wait till things are really terrible to get help. And a lot of people that need help aren't able to afford it and aren't able to find a legitimate therapist in their neighborhood. And so I want people, for the price of a salad in Los Angeles or New York, to be able to get the therapy that they need.
And to your point, and we'll get back to the emotional regulations, I want to talk about that. Since COVID, prices for therapy have skyrocketed to a place where I don't know how people who even have money can do this on a regular basis. I mean, things that even were like, I thought 150 was expensive an hour. Now, like the going rates, what, 300, 350, 400? Right. People are going up to $500 an hour.
Right. So, and for people that need it, I mean, the cool thing about behavior therapy is it's like time limited. It's like when I was in grad school, signing up for therapy meant like signing up for life. Yeah. And now, I mean, my goal is like, come in, we'll learn some skills. We'll see each other for, even if you're severely depressed, have panic attacks, we could treat that in a matter of 12 weeks usually.
Really?
Yeah.
So that's the other thing. A lot of times what people end up doing is they go to therapy forever. And that's how that person works. I mean, they don't ever, I don't know if they ever like see progress or whatever, but to me, I mean, if you're going for something that's actually an issue or a problem, there should be places and things in place where you actually could see progress.
Absolutely.
And have the tools or be given the tools.
Absolutely.
To help you help yourself. Because otherwise you're just going and going. And there's also this whole other theory. I don't know if you what your take on this is, but actually, I'm not even going to talk about it right now. I want to talk about
regulation.
I want to talk about and then I'll get into what I was going to ask you.
Okay, so there's so many different ways we can talk about emotion regulation. I mean, the simplest way I think to think about it is before an emotion even takes place. And the way that I'm explaining this comes from dialectical behavior therapy, so I want to give credit where credit is due. This is one of the most research-based treatments for people that really struggle with intense emotions. And what happens is before an emotion even takes place, we have what's known as vulnerability factors. So things that can make you more vulnerable could have happened today, like you didn't sleep well last night, you didn't have time for lunch, you got an annoying text.
All the above happened to me today.
Yes, and I'm sorry to hear that. Or things, you could have vulnerability factors from your past. You know, if you were in a car accident, maybe getting into the car is more stressful for you, even though that happened 5 years ago. But again, therapy can help you with that.
Right.
And so before an emotion even takes place, we have vulnerability factors. And so each of the things that comes, each of the pieces of the like recipe of an emotion, we can then target for interventions. And so getting ahead before you're like exhausted and haven't slept and haven't worked out and haven't had lunch, like making sure to do those things, because then you're just setting yourself up for an increased chance of being able to manage your emotions. Right. Because like, I don't know about you, but like if I haven't slept, like my bandwidth is like so much lower. And that's like, you know, we all know that to be true. And if I haven't worked out, I know the same is true for you. Like I can't even think as well.
I can't think at all. My focus, my ability to be really kind of cognitively present is down. So these are basically, you're saying the best way to emotionally regulate.
So that's just the first step. Like first step is vulnerability. Like what are the things that you know reduce your vulnerability?
Increase your vulnerability.
What are the things that from the get-go could boost your bandwidth? I call this in the book buffers. Like what are the things we could do preemptively to set us up for success? Like you would not go to a job interview like not having prepared. To manage emotions, you need to get ahead, like the sooner the better. And so making sure to really, I know this is simple but profound, like what are the things that don't work for you in your life right now? If you feel like you have no time, spending 17 hours a week as the average person does on social media is not good for you. And skipping times with friends in real life because you're so tired because you're on your phone late. I mean, these things are not good for you. So the first thing, just very simple but complicated. How can you manage, like reduce your vulnerability, boost your resilience? There's a lot of things
when you're using the word buffers or vulnerability, I say habits, like habit stacking.
Yeah.
Like, how do you habit stack your life?
So vulnerability is the bad and the buffer is the good. But
vulnerability is the bad, but the buffer is the good. So you're the word that's like you're saying buffer, I say habits. Is that really about habit forming?
Yeah, totally. Okay. I love that.
And so some of the habits, so first knowing what your trigger or vulnerability is, and then building habits around
creating a lifestyle that like just sets you up for
success,
more ability to cope with whatever comes your way, and also just sticking to your habits. And I know this is such a huge part of your work. Just changes your mindset about your ability to cope with hard things, and that is so important with emotion regulation. Also being aware of our beliefs. Like, do we believe I can't cope with my emotions? They go on forever, because even that is a risk factor for struggling to manage emotions. It's like, if you think you can manage your emotions, you actually have an increased likelihood of managing your emotions. And then, so vulnerability is the first thing. And then there's whatever sets you off, the prompting event, the trigger. And then there's the interpretation. So let's just say the trigger is you really like someone and they didn't get back to you on a dating app. The interpretation could be like, nothing will ever work out for me. Things never go my way. I might as well give up. That obviously is going to create a different emotion than, okay, you win some, you lose some. This is a bummer, but like, I don't know what's going on for this person, and I'm going to be kind to myself because I don't deserve to like struggle with because someone I don't really know decided to reject me. And so our interpretation is like the first like big thing. And obviously there's so many different things that come up in our lives. It could be a friend wasn't that kind to you. And one interpretation is like, everyone stinks. And another is like, they must be going through something, or they're having a hard time.
Reframing your brain.
Exactly. So one of the biggest takeaways with managing emotions and managing stress is being mindful of our interpretations, because they come up so quickly. We don't even realize that they're interpretations. And so being aware, I divide the book into thoughts, feelings, and behaviors, and things to do at each point, your mind, body, and behavior, because our minds have so much to do, and there's so many different tools to get into that. So the mind is first in terms of emotion regulation. Obviously, your mind is going to do something to your body. If you think something awful, your body is going to react in turn. And then many times people get into this like terrible dance. I shouldn't even call it a dance because it's like so unpleasant, but your mind is telling you the worst thing, catastrophic thinking, worst case scenario. And then your body is like obviously tense. You feel like you can't breathe. And then your behavior is like doing something that it's tempting to get into something, to do something that's like a quick fix, escape, or make things, do these things that often make things worse. And so a huge part of emotion regulation is learning to think more flexibly, allow your body to react, because when we're not micromanaging and policing our body or judging, like, oh no, I'm short of breath, like I need to like take a nap and then mess up the plans that you have, or I need to smoke a joint, or I need to drink. We need to really be aware of like what we're thinking, how we're responding physically, be more accepting of our physical sensations. And then really a huge part of emotion regulation is being able to choose our behaviors, because oftentimes when people tell me that they struggle with emotion regulation, it's like they're upset about their behaviors. They're yelling at people they care about, their kids, their partners. They're totally procrastinating. They have no sense of like, I'm in the driver's seat. Like I'm in charge of my life. But these are things we could change if we know how at each point. Like
to actually change them.
Totally.
But life, I feel, especially in the last, I don't know, well, it's getting more so with all the technology. But I feel like life moves so quickly now, and there's so many more expectations. Like now you have to be like, just for an example, if you are someone who's a company, a brand, just a regular person who's an entrepreneur, you have to build a personal brand. That means you're going to be on Instagram and all the social media. And then you got to learn to be a producer, because you got to put all the content out. There's so many demand and if you're a mom as well. Like there's so many demands being put on people that's getting layered and top of layers. So people's stress levels are really becoming, I believe, like unmanageable. And what I've noticed is almost, and this is really sad to me, almost everybody I know are on some type of antidepressant or anti-anxiety medication where it's become so prescribed, where it's there's no stigma anymore. It's like, well, of course you're on this. I mean, honestly, I've never taken at either one of those. And I just live in my anxiety basically, or my franticness, because I believe that, that has a vicious cycle that goes with it. I want you to talk about your belief system on, medication and what it does, like what's the adverse effects that can happen and why people maybe should stay away from them.
Right. So I'll just specifically talk about anti-anxiety medications. And I should just say that I'm not a psychiatrist. I'm a clinical psychologist, and everyone should speak to their doctor. But, and I have a lot of clients that do find antidepressant medication, SSRIs, can be very helpful. And for people that have things like bipolar disorder, medication is really a frontline treatment. And so I don't want
any mental illness, though. That's a different type of.
Well, some people have clinical depression, maybe like major depression, and
I guess I should clarify. Anxiety. You're right. Let me clarify. I'm talking about like managing day-to-day life. It's an easy fix. You go to a doctor, they give you a pill, and you're good to go. I'm not talking about people who have true medical, like a true mental illness, like bipolar or schizophrenia or even clinical depression.
Right.
I'm talking about it's become so common now, like popping a candy, where it's like an easy fix that people become dependent on this as their coping mechanism.
Right. Yeah. And to get back to the first part of what you said, because I think that was so brilliant, like life is really busy right now. Things are really frenetic. We have to be doing a million things. You don't just like do one thing at a time anymore. But we sort of can choose to do that. No one can, like, just thinking about juggling, the idea of juggling stresses me out. And we shouldn't have to do that in our lives. We could really try to do one thing at a time and put the phone in the drawer, put the phone in, like, I like this thing called a K-Safe, which is like a time lock container. If you need to do the social media stuff, like do that for a set amount of time,
don't tell me. I wonder what is that thing?
A K-Safe is like a time lock container. You decide how much time you're going to put it in the phone jail. And a lot of my clients that have ADHD swear that this has been so helpful to them because, again, these devices are like designed to be addictive. And so we have a lot of the tools within us, and a lot of them are obvious but hard to implement. But again, if you feel stressed because you're doing 27 things at once, I promise you will do things better if you do one thing at a time thoughtfully, because I don't know about you, but if you're, I said a few times, but if you're going to the market on the phone, you're probably going to forget something that you came to get. And then if you're also texting, you're probably going to like rear end someone, it's
my life. I go to the store, I'm on the phone, I'm thinking multitasking. I end up going to the store 4 times because I keep on forgetting something.
Again, so a quick thing for anyone listening, like just one thing at a time, I promise you, fast track like that, you will save more time. And then
the idea of multitasking is really then a bad idea.
Totally. That's one of the resets in the book, like just one thing at a time. And I understand. I have 3 kids. I have a full practice. I see clients that are really struggling. And I write books and articles, and I totally get.
That's why I wasn't texting somebody.
No. Yeah. I totally get that it's hard to try to do one thing at a time if you're juggling a lot, but to notice the urge and to try to just do one thing at a time. And then with regard to medication, look, anti-anxiety medications is a specific class of medication. Most people, when they say they're taking anti-anxiety medication, are referring to benzodiazepines, which are medications like Xanax, Klonopin, Ativan. And these medications are really interesting. I mean, first of all, they all have black box warning labels that they're not designed for long-term use. They're extremely addictive. They also, a lot of studies have found that they can contribute to cognitive decline. And these medications like slow us down. And so when we need to be our sharpest, people are like sedated. And also, it's so disempowering to think I need to lean on something outside of myself rather than I can do this. Okay, I feel stressed because I'm doing 27 things. Anyone would feel this way. How do I like manage things or use my stress to troubleshoot? And again, stress is the price of meaningful life. If we even like reframe stress as an opportunity to problem solve or to pursue our goals, taking a medication, again, is like maybe maintaining you on the hamster wheel that you can't possibly maintain. And so these medications are incredibly harmful because short term, they're not helping us do the things that matter to us. Long term, they can have very serious adverse effects. Getting off these medications is incredibly complicated and full of horrible side effects. But that side is why if people are listening and want to get off, a lot of medical professionals can help you with a slow taper. But I mean, these medications, interesting, like even their history fascinates me and depresses me at the same time. But they're like Arthur Sackler of like the opioid crisis notoriety, like helped advertise these as mother's little helper in the 1950s to women dissatisfied with their lives as housewives. And it's like, oh my gosh, like that is totally not what we want to be doing. Like if you're not happy with your life as a housewife, like let's figure out how you can be happier. And that's kind of what these pills do. They like numb your body into submission when what we want to do in the treatment for anxiety is really learning to like accept your body and accept stress as part and parcel of life.
Right. Stress is a part of life. And not all stress is bad.
Not all stress is bad. I mean, again, like you don't want to go on vacation for too long. You don't want to sit camping for like months on end.
Not at all.
I mean, that would be terrible, like, even on a beach. I mean, that's not relaxing. And if we interventions for college students that teach like first generation college students in 30 minutes, like again, it's not years of therapy, a 30-minute quick intervention with like a large group of like stress is an opportunity for growth and your body's stress response is helping you. Like if you have knots in your stomach, that means you might be doing well. That means your body is like really rallying to help you perform. People that are exposed to that 30-minute training actually have reduced cortisol. They have less body stress in their bodies, and they actually perform better and are more likely to complete college than people that aren't exposed to this. And so this mindset that like, I'm too stressed, I need to like take the day off and like take pills and smoke a joint. Again, like I know cannabis is also kind of complicated, but everyone that I'm working with and my friends included, like the thing that they most want is motivation, and cannabis like causes a motivation.
Oh my God, it's the biggest demotivator. I mean, there are people I talk to, they're like, oh my God, I worked out on when I was high, like I was totally high. I'm like, how is that even a possibility? Like if I'm high, I can't leave the couch and I want to just watch Netflix.
Like, right. If your life feels overwhelming, we want you to be sharp and motivated.
Like, that's like the worst way. It's like it dulls all your motivation.
Totally.
I never really understood the connection, but I guess, you know, I think people like that's why you're here, right? It's like we lean on the path of least resistance, right? The thing what coping mechanism will get me to a place where I could either be distracted or not think about it and not really do the work. Like at the end of the day, it's like everything that requires any type of movement or growth requires work to be put in it, right? Like all this, like action items.
And Jen, it's so hard because like the things that people do,
yeah,
and we all do them, right? Like I certainly have have procrastinated in my life. But the things that we do, it's so hard because immediately they work, short term they work, long term major backfire, but we forget the long term. We're just so focused on the short term. And so my big thing is, truly, I'm 100% convinced that you can reduce your stress in minutes. No long meditations, medications, or martinis required. You just need to know exactly what to do, and different things work for different people. And that's why I offer 75 different resets and buffers in total.
Okay, I want to talk about some, because you were saying there's different mind resets and there are body resets. So talk about some really easy mind resets we can do, and then talk about some body resets.
Sure. So one of my favorite mind resets. So look, again, some of us have thoughts that are helpful. A lot of us have thoughts that are totally not helpful and don't serve any purpose, right? And so if you have a thought that's productive, obviously you don't want to just like lose sight of that.
Yeah.
But like 80 to 99% of people say that they have intrusive, unwanted thoughts. I'm a loser. No one likes me. I can't do this. It's too much. I can't. For thoughts that like are recurrent and bother you, even just telling yourself without getting into the weeds, I'm in emotion mind. Like emotions are running the ship. Like it's Saturday night, I don't have plans. So I'm just telling myself I'm a loser. To even just see like from a bird's eye view, like I'm an emotion mind is so different than getting stuck in the rumination. Like rumination is one of the biggest sources of stress, but to just even spam filter. I'm an emotion mind. You have filed it away. You don't need to unearth something telling you that you owe $1 million to the FBI. I mean, it's
but people, the rumination, you talk this a lot in the book, the rumination, overthinking, that's where I think a lot of people struggle.
That's the biggest cause of chronic stress. A lot of people think that chronic stress is their life, but it's, of course, a lot of people have a lot of legitimate stress, but the overthinking is what stress researchers are very clear takes stress and creates the chronic stress.
How do we stop overthinking?
There are a lot of different things. I have like 10 ways to get out of overthinking in the book, but some of them—
3 good ones.
Yeah, I mean, 3 good ones. One of them is interesting. If in another study using college students, because a lot of these psychology studies use college students because it's an easy sample to obtain. But in college students that were depressed, when they wrote for 20 minutes a day for 3 days about the most upsetting thing that happened to them, 3 times 20 minutes, they ruminated less in the aftermath, and they also had reduced depression 6 months later. And the reason is because a lot of times we're just thinking, but it's like a news ticker. We're like barely focusing on what we're thinking about, and we're not actually like going deeper and processing. And so if you're constantly like kind of thinking about something upsetting that happened to you, if instead you go deeper and actually write about it, put it on paper, close it out, that is really helpful for something that's unprocessed, that is like haunting you. This is very specific. Again, different things work for different people.
Yeah.
This is if you are like ruminating about a past relationship or a problematic parent or a loss, doing this specific kind of writing is very helpful. Another technique that I love when it comes to rumination is like swapping the why me? Why does everyone else have it?
The victim
just like
mentality.
These why you're never going to land on, like, we don't know why. Like, we have to accept uncertainty, but swapping why with how. Like, why did this other person get the job that I wanted? How can I move forward despite this news? One is productive, has like an endpoint, gives you a sense of empowerment. The other is like circular loops, nauseating, not helpful. Another thing that I like when it comes to ruminating is actually problem solving. Like a lot of the times we ruminate, like obsess over something, but again, similar to the how, like let's come up with an action plan. And even just thinking there's different things you could do, but even practicing like mental time travel, like how will I feel about this 5 years from now? It's like, probably you won't remember it. But again, like we're really into the weeds. And so learning to play with your thoughts, whether it's time travel or I talk about singing your thoughts, because a lot of us,
I love that, singing your thoughts. Is it just because it changes what's happening in your brain, or you're changing the vibration of your brain, or how
you're
does
changing
it work?
your relationship with the thought? So we were talking about like mind resets. And so this is one of my favorites. A lot of us have thoughts like, I'm not good at this, or it's going to be bad. And instead to like, what if you sang that song to like an upbeat tune, like a recurrent thought that bothers you? I'm sure we all have a thought like, I'm not enough. If there's a thought,
and then singing it, like
if you have a recurrent thought, I'm sure everyone could think of.
I'm not enough, like that.
Yeah, if this thought constantly like eats at you, taking that seriously, like I'm not enough. That's like really demoralizing. But if you see, okay, this is just what my mind does when I'm around people that really impress me, I start to tell myself I'm not enough. And if I like sing that a few times, it quickly changes my relationship. Yeah. So I see, hello, emotion mind, neon lights, emotion mind, rather than that's like dictating my life and scary and upsetting. It's like, okay, this is like, it was funny in a psychology conference, we all had to like, instead of name tags that said our names, we had to like write down a thought that we had about ourselves. And it's like every single person, even people that you really respect, leaders in their fields, have thoughts of like, I'm a loser. No one really likes me.
Everybody does.
Everybody. But what if we laugh about it? What if we laugh about it and play with it rather than let it like boss us around and cause us depression and anxiety?
I think I talk about that a lot. I think that if people always, over-index and put other people on pedestals and think that, they don't have the same problems, they don't think the same way, like people who they aspire to be like. What I just even doing this podcast, because I've interviewed almost everybody on the planet at this point, I find that
so cool. Congratulations.
Oh, thank you. But what I was going to say is the one thing I've noticed is everybody's the same. Nobody's different. Just because someone has more money in the bank account, or the perception that you may think from social media is that they have it all, or this. Everybody struggles with the same stuff. It's just about how you cope with it and what you do with it and what actions you're applying to manage them, really. Like nobody's different. You're not any, you're like nobody's worse or better than anybody. We should have an equal playing field in terms of how our brain, how we talk to ourselves and think about ourselves and feel about ourselves. It's true. And I find that to be like something that I noticed really fast or not fast. It took me a minute, but pretty quickly, I guess. But is there a difference between anxiety and stress, or is it the same thing?
Stress is often when there's too much externally coming at us. It's those moments where we just feel like what we're facing exceeds what we can do. It's those moments when you just feel like, I'm carrying too much. I can't possibly do anything more. And anxiety is really the worry and the physical sensation. So stress could easily lead to anxiety. But very interestingly, like stress is a lot about perception. And so if we believe like we can cope and stress is something that we can deal with, and I know how to manage my emotions, I know how to manage stress, I know how to implement behaviors to make things better for myself, then we're able to reduce stress and also reduce anxiety. We could also reduce anxiety using similar strategies. But getting back to like we all struggle, that's another one of my favorite mind resets is practicing loving kindness meditation. Because again, there's this like shared humanity, and a lot of us are so hard on ourselves. We're like, we make a mistake, a legitimate mistake, because we all make mistakes. And rather than beating ourselves up, like practicing, going through a series of people, starting with someone that naturally brings warm feelings. Have you heard of this practice?
No, I'm interested though.
So bringing someone to mind that naturally evokes feelings of warmth and love, like a pet or a grandparent or child, and bringing them to the forefront of your mind. May this person be happy, healthy, safe, live with ease, and saying that really like you mean it, and like you're giving someone this gift of these things actually happening. And then yourself, may I be happy, healthy, safe, live with ease. And then you go through a series of other people, someone that you care about that's having a hard time, familiar stranger, like someone that you see at the grocery store, somewhat difficult person, not the hardest person, but slightly difficult, and then all beings. And it's just this reminder that like we're all going through something. And also instead of like the negative of like, I'm the worst and everyone else is terrible too. Like purposefully inserting positives. And this might sound like kind of fluffy but there's so much research behind this, reducing self-criticism and increasing feelings of connection.
I love that. That's a really good one, actually. Give me one. Well, do you want to move on to body resets, or want to give me one more?
Up to you.
I love these types of things because it's, like I said, it's super tangible and people can like really do something in the moment. Give me some body ones.
Sure. So body ones, I want to give you something counterintuitive. And so for people, this is actually a body buffer, and then we'll talk about a body reset. But for people that have physical sensations.
What's the difference between a buffer and a reset?
A buffer is like, a reset is what you do in the moment. Like, I am really stressed right now. What do I do right now? Okay. And a buffer is like, what do I do preventatively? Like preventative medicine, because I know things are going to be stressful. What are things I can do that now that some of my peak stress is gone? What do I do to like not go from crisis to crisis? Okay. So a buffer that I love is because so many people, even if you don't have panic, a lot of people when they're about to give a speech might feel their heart racing or sweatiness. Some people driving gives them like a lot of muscle tension or sweatiness, sweaty palms. And so a lot of people get into this thing because if it feels like your body is like rebelling against you, your mind is going to start thinking like, oh my gosh, I'm in danger. I need to pull over. And so I really like helping people practicing recreating what they notice their body does in stressful moments. So if you notice, like when I'm about to go into a really important meeting, I start to feel like I can't breathe, we can help you. Like a big part of treating panic and also treating physical sensations of anxiety is helping people recreate those. And so I help my clients, take a skinny straw, like the coffee stirrer straws, or take a regular plastic straw and pinch it, and then pinch your nose so you're only breathing from the small aperture of the straw. And like they're blown away, like, oh my gosh, like I can make that happen. Like I can make that uncomfortable feeling that I thought only happens to me when I'm like flying and there's turbulence. I can make that happen like in my living room right now. Yes, you can make that happen. And then when you practice welcoming you can start to uncouple the physical from the negative thoughts that escalate the physical and that really keep you in this situation where you're really trapped. And so I think that's very interesting for people to realize. If you have like an acceptance around physical sensations, this doesn't take very long. It takes literally like 5 minutes to recreate some of these sensations, and you practice it for a couple times.
And you've seen success with this.
Oh my gosh. It's one of the most proven ways to treat panic attacks. And for people that have public speaking anxiety, this is a really integral part of the treatment if they're scared of physical sensations when they speak. I think this is actually part of like a newer treatment that's one of the most evidence-based ways to treat people that have a bunch of diagnoses like general anxiety plus panic plus social anxiety. Like if you want to treat them all in one 12 session treatment, interoceptive exposure, it's called, like accepting your body sensations is huge. And this is, I think as an athlete, you probably already do this, but I think a lot of people, if they're like running upstairs, if your interpretation is like, this is normal, I'm running upstairs, it's fine. It's like, that's a good workout. If you're like, I'm out of breath, what's wrong with me?
Right.
Should I see a cardiologist? Yeah. And again, like there are times that your body is giving you a signal, but oftentimes when we're stressed, it's a false alarm, and learning to really see clearly, like, okay, I don't need to police my body. It knows how to run itself. On the flip side, I think like slow breathing is really nice if you want something to really, in the moment, to reset. Breathing in for 5 and out for 5, which is much slower than the way we normally breathe. We usually breathe about 18 breaths per minute, and doing the 5 in, 5 out. I was blown away. I spoke to two psychiatrists, husband and wife, Patricia Gerbarg and Richard Brown, who are affiliated with Columbia University. And they actually told me that they teach people in war zones this specific breathing exercise, the 5 in, 5 out coherent breathing, they call it. And they've had success with people, even with so much going on around them.
Really?
Having had really positive effects. So much so, I was so moved by this, finding that a percentage of proceeds from my book are going to their cause, because I'm like, this is unbelievable.
Are you serious?
Yeah.
Jenny, Dr. Jenny, I love that.
Yeah, no, I'm like, I don't, I mean, the purpose of this book is like, I want to help with stress relief. And
you really do want to help with stress relief. And I think you do, because there's a lot of great stuff in here. You know, I like the one that you talk about putting your head in like an ice bucket or like a salad bowl of some kind, like your face, I should say. Kind of like a cold plunge, but for your face, because it also resets. What does it do exactly? Like what's the medical or science behind that?
Sure. So this is something taught in dialectical behavior therapy for people that feel really intense emotions, like they really struggle with managing their emotions. Something really upsetting just happened.
Right.
If you feel like, oh my gosh, I need to go do something really impulsive, this is something that you could do that has no negative side effects. I should actually say that this is not good for people that have cardiac issues, because it lowers your heart rate quite quickly. So if you have a cardiac issue, you should not try this. But for people that are wearing like an Apple Watch, if you took a salad bowl, fill it with ice, set a timer for 30 seconds, so hold your breath and submerge your face in ice water, your heart rate will come down pretty quickly. It's because of the dive response. A human body that's submerged in cold water while holding their breath, their body will quickly like redirect blood flow from non-essential to essential organs. If you've ever jumped into a pool, I'm sure you feel very like different physiologically.
It's basically like doing a cold plunge on your face for 2 seconds.
For 30 seconds, 30 seconds to 45 seconds. And you could do it for up to a minute. But you don't need a whole fancy cold plunge. You don't need a cold plunge. You need a salad bowl.
This is what I like about this. Like, you don't need a cold plunge to get the same benefits. You can also take a cold shower. Like, by the way,
this is very specific. The dive response is very specific to like holding your breath. But
that one I'm saying, but just in general, right? Like a lot of the things, there are all these other alternatives. So if you don't have one thing, that you can figure out by doing something else.
Totally.
But that one I think is a really easy thing for people. Everyone has like a salad bowl or something where they can just put they can just immerse their or put their face in.
Yeah, and again, all these things are like tackling multiple things at the same time. Okay, then that automatically reduces stress in your body. You will not be ruminating by the time you pick your head up. And also like behaviorally, like you just learn that you can do something difficult and that you can take good care of yourself. And like that's like 3 for 1.
That you can, it teaches you can do hard things. And a lot of this is basically teaching yourself that you'll be like, you will be okay. This moment will then pass, right? And just like kind of shifting your energy or your focus somewhere else. The one that I loved, I thought this was so true, is eavesdropping. I thought eavesdropping was great. Like you said in the book or something, like if you start to eavesdrop on someone's conversation, you totally forget like what your thoughts are about your brain or what you're thinking about or your negative self-talk.
This is so interesting. So in a study where people were asked, and this isn't one of like the resets, this is just an interesting.
No, I know, but it's great.
It's so interesting. I mean, in a study when people are asked to write about, forget if it was talk or write about the most upsetting thing that happened to them while hooked up to like all sort of physiological measures of stress. These people literally, like to the point of ruminating is bad for you. Talking about something that happened 20 years ago will put your body in the same state as it was 20 years ago. And so half of the participants that did this had the option to eavesdrop on like a stranger at the lab, which I'm sure was not like juicy TMZ gossip or your social club gossip. It was like a random person in a psychology lab. I'm sure it wasn't that juicy. The people that were eavesdropping, they quickly returned to baseline just doing something really easy. Like, again, not even just the chance to do something different recalibrates you. But unfortunately, like the downside of being human is like we have a knack for thinking the worst, making things hard for ourselves, judging normal responses, gravitating towards things that help in the short term and hurt us in the long term. But we're also remarkably good at getting better if we know how.
Yeah, we are. We got to give ourselves more credit and try to implement these things, right? Like
totally.
That's what it really comes down to. Okay, so give me another body reset. I love the body resets. Oh, let me just say this too. Like this is not to simplify anything, but like the best mood enhancer, the best antidepressant or best anti-anxiety is, guess what? I say it all the time, is exercise. That will change your mood and shift wherever your brain is any negative thought in like, again, in a second, right? Because like you're again, like sometimes also when you're exhausted and tired or huffing and puffing, you don't have the ability to even think about what you were thinking about, but also the endorphins and the dopamine, right? Like, is that the number one thing?
I love exercise. I mean, it's like my happy place. I will smile from ear to ear anytime I'm in a gym class. It's also the thing that like I make my whole schedule around I mean, like.
Good for you. I love that. What's your class that you like the most?
I do, I'm going to get in trouble for saying this, but I do SoulCycle and berries.
Why would you get in trouble?
Oh, because I feel like they're very like, go to one or the other. And I shouldn't say.
I think they're both really good in different ways.
Yes.
But I don't like SoulCycle. I got to be honest. I hate like the bike I could do like intermittent, like kind of like intervals, but I can't sit and do an entire workout on a bike.
Maybe we'll go together.
Yeah. I mean, we can try, but I know I'm digressing over. It's not like a workout podcast, but you know what?
No, these are but you know what? There's so much that I love about it. It's like the music, the being part of a community, the inspiring. Yeah.
It's true. You know what? Like a lot of times you go to these classes, not for the actual workout, but it's for all the other ancillary things that you're getting. Like you said, the community, the music, the feeling of like doing something in a group. Like it's like all of that stuff. And it's not even so much like it becomes like it's like a ritual, becomes part of but to me, like, can't all of this be solved? Not all of it. A lot if people just incorporated exercise daily into their life. It would like lower their cortisol levels. It would make them, it would enhance their mood. It would change the brain chemistry. It's something that's so basic. People don't really want to listen to it. They'll do all these other crazy, kooky concoctions and things as opposed to doing the one thing that actually works the best.
Right.
Because it's not sexy or glamorous to be like, go for a walk.
Right.
Like exercise.
Right.
No, we don't want to do. Why would we do that? We've heard that for too long. Let's talk about something that we haven't heard of that is so outlandish that doesn't work anyway, but at least it can, be a trend.
Yeah. And I want to honor, I know some people have like really difficult jobs where they don't have a lot of time or they don't have a lot of resources. Like I'm just thinking about like a home health aide or someone that's working like around the clock that might not be able to easily exercise.
Let me just interrupt you. I know that people say this. I'm not saying to go to Equinox and spend hundreds of dollars on a membership. I'm saying walk out your front door and go for a walk. It's free.
Yeah.
It's free. And it's the barrier to begin is very low.
Right.
And it will 100x your life quality and happiness. Like actually not even 10x. It was like 1,000x your
No,
life quality.
Yeah, I love exercise. I'm just thinking about so many of the people that maybe just had a baby or they can't like that may not have like the childcare, like the freedom to, but even then you could say a stroller. Yeah. It's true.
You know, listen, I'm a believer. I'm a believer that if somebody wants something bad enough or the pain is that bad, they will find a way and they'll figure it out. There's a lot of options out there. And it's about then just like choosing to do it or choosing not to do it.
Yeah. And I also love like really celebrating like anything and everything counts. Like if you can't go to a 45-minute class, like 10 minutes counts.
10 minutes.
Yeah.
By the way, these little 10-minute whatever increments, they're like, they accumulate into something big. People think, oh, I don't have time. I only have 7 minutes. Guess what you can do in 7 minutes?
Well, I have studies on that. It's like literally the second part of TIP. Like TIP is this body reset, which is the starting with the ice. The ice is the temperature. Then the I is intense exercise. And that's like 90 seconds, like burpees, squat jumps, quick, fast, getting your heart rate up, because that again, like is a quick thing and
it's
you
like
don't need
workouts too.
Like,
super quick.
But even like literally if you can't do a HIIT workout, like 90 seconds, if you're about to go into a meeting and you're really overwhelmed or you're about to go into a very painful conversation, to be able to know like the ice phase plus the intense exercise, then the paced breathing, the slow 5 in, 5 out.
Is that the P?
There's 2 Ps. One P is the paced breathing, which is the 5 in, 5 out. The second P is progressive muscle relaxation, like tensing and releasing, like from your forehead to your mouth to your neck, like shoulders.
How do you release your forehead?
Tense and then release. Notice the difference between tension and relaxation in your forehead. With each breath, further relax your forehead. You can tense your...
I'm trying it right now.
You just go in order because a lot of us hold tension without even noticing Tense your shoulders, release. And also, again, like this, how can you be ruminating if you're focusing on tensing your shoulders?
Exactly. It's basically just distractions from what like these are all just tips and tricks of distracting yourself from what the negative thought is, or the rumination, or the overthinking, into a different state of mind.
I think of it more as expansion, because a lot of times we're not in this current moment and we're not aware of, like when I do the body scan, I feel so much gratitude and appreciation. And a lot of times we're not even aware of it. So it's not even like the other stuff is distracting us. And this is like anchoring us in the present moment.
I love that. What about, okay, so I have my other questions. It's on my
behavior
phone.
Resets.
Hold on a second. No, I don't want to talk about every reset, but I asked you about cognitive diffusion. See, we talked about that, like singing your thoughts, right? We did talk about that a little bit already. Is there anything else like eavesdropping, actually, you want to talk about? I love like things that like, if you can tell us a couple of things that we may have not heard before.
Sure.
That's why I like the eavesdropping. I never really heard about that, except I do like the page on social media, Overheard in LA, which I think is very entertaining, which then it's basically being eavesdropped on, which I love. Is there anything else like that you can think of?
Well, one thing that I think, again, is that we know, but we forget in the moments that we need it most. And the eavesdropping, again, I just want to be clear. Like, I'm not saying that's the only thing. Like, everything count. Like, noticing flowers, noticing trees, noticing water. Like, there's so many ways we're like not in the moment and not aware of like
magic, walk through the world and not pay attention.
Cute dogs, cute babies, cute elderly people. I mean, there's so many things that we're not noticing so much around us. And for us to really like center, like listen, like 3 sights, 3 sounds, 3 sensations. Like get here. Like you don't need to be in the future, past, worst case scenario that will never happen. Something that we don't realize, but I think is so helpful to think about, that has personally changed in my life and is kind of like how I run my life, is there's a skill called opposite action, which is like we act on our emotions. We're angry, we yell. We are sad, we cancel. We're anxious, we procrastinate or avoid. And we forget that like how acting on our feelings as part of that emotion regulation cycle just keeps us stuck in those feelings. Like the more we yell, the angrier we are, the more we avoid, the more anxious we're going to be, and the smaller the scope of our lives. So I just love asking yourself, like, what do I want to do in this moment? Is acting on this wise? And if it's not, what does opposite action look like? And like, let's do it all the way. Like a lot of times we're doing the splits. We're doing like the right thing, but our mind is like, this is terrible. I hate this.
I think that's actually very true. I think what happens is we're autopilot, like we're on autopilot. We walk through our lives. We may do the things, but our body and mind are not doing it connectedly. right?
Yeah.
And so hard for some people, me, one of them, is to sometimes get that connection because your brain's moving at 1,000,000 miles an hour.
To make it easier if you're doing it already, if you're already going to work, like try this. I mean, try this. Like, let's let go of like everybody sucks and I'll do it later. Let's try to see like if you really think like this, I'm happy to be here. And obviously, like if you want to look for another job, look for another job. But the more you're able to get things done and not judge the people around you, the more bandwidth you'll have to look elsewhere.
I mean, yeah, that's true. And also I think that this idea of, you said this earlier, but like, I'm such a great multitasker. It's like, it's become,
No, you're not.
Right. And nobody is. And they we think we are. And and it's been very like highlighted in today's time. That's like, it's been very praised. When the truth is like, if you do focus on one thing and do that really well, like I know I multitask, I'm doing nothing well versus like I'll do everything half-assed versus doing something, finishing it, doing it good, and or finishing it, doing it well, and moving on. Okay, so you said to commit to 3 minutes of mindfulness. Why 3 minutes?
So there's a specific research around this thing called mindfulness-based cognitive therapy. Mindfulness-based cognitive therapy is a specific treatment for people. It was initially designed for people that have had multiple episodes of depression. So if you have been depressed twice, oftentimes psychiatrists will keep you on antidepressants because there's a very high likelihood of relapsing into depression. It's kind of like it's becoming a well-worn path. And so psychologists were curious, Zindel Siegel and his colleagues were curious, like, is there something we could do to get people off antidepressants and prevent the risk of relapse? Is there something behavioral we can do? And so remarkably, people who participate in mindfulness-based cognitive therapy, which includes about 20 minutes a day of mindfulness for about 8 weeks, that's
How
a lot.
much?
8 weeks, 20 minutes a day. They are able to reduce the risk of relapsing into depression as effectively as medication. But here's the thing. After the 8 weeks, no one's sticking to the 20 minutes. And so the thing that people do after the 8 weeks, after you have some experience of seeing thoughts are just thoughts, what's happening with my body, learning to breathe, learning to be more aware, paying attention in the moment, after the 20 minutes, people usually just stick to the 3 minutes. And Dr. Siegel, who's a colleague of mine, says that the 3 minutes alone is the thing that helps. Like you don't need to stick to 20 minutes for the rest of your life. Most people just stick to the 3-minute breathing space. And I like the 3-minute breathing space because the specific one that I teach in the book, because it's just a quick reminder. It's so hard in the moment to remember. What am I thinking? What am I feeling? What do I feel like doing? And remembering that emotions come in waves. Like we all need to remember emotions come in waves. How I feel right now is not going to go on forever. And I'm not good at predicting how I'll feel in the future. A lot of times we grossly overestimate how bad things will be and underestimate our ability to cope. And so just 3 minutes is like a good way.
Underestimate it. Mm-hmm.
Yeah, it's incredibly powerful to just, you don't have 20 minutes every day. But if you have 3 minutes to just, in a quiet time, get clear on what's going on with your mind, body, and behavior, it's a little easier to tap into that when you need it most.
Are these strategies things that you've used on yourself personally that you were struggling with?
I use these all the time, and I don't even think it's like struggling. It's just like optimizing my life. Or even if the struggling piece, like I think it's interesting. I'll tell you a quick story that I don't think I've shared on a podcast, but I was at a conference when I was early in grad school, like maybe my first year in grad school. And I hated the thought of public speaking would like make me want to throw up. It's actually interesting. Like I never had a hard time like being conversational in like a lecture or something. If I would raise my hand for a question, but I would never like want to be on the podium.
Right.
And I was part of I did like this workshop with this like leading psychologist whose books I had read, and he was like a leader in the field, and I really respected him. And I did his workshop, and I was participatory. And then he saw me like walking around the conference center, and he was like, "Oh, are you giving a talk as at the conference?" And I was like, "Oh no, I don't give talks at conferences. I'm not a good public speaker." And he said to me, "Did you thank your mind for that thought?" I was like, "Did I thank my mind for that thought? What does that even mean?" But it's like, did you thank your mind for that thought? Like, that's just a thought that like came into your mind. I could say, "Thank you, mind." And so I truly a million times while writing this book, or even before this podcast, it's like, will this be okay? Will people like this? But it's like, okay, thank you, mind. Like you care. Let's get centered in the moment. And so I truly like all of the things that I want to share with the world are the things that have changed my life and the lives of my patients, and that I think all successful people are trying to make habitual.
I love that answer, because you're just kind of, again, you're just also making notice of what your brain is saying, what your mind is saying to you. What's the difference between your mind and your brain?
When I think of brain, again, I'm not a neurologist or anything, but when
No,
I think of
just
brain,
asked me that question, and I'm like, you know what, I'm going to ask you.
When I think of the mind, I think of, yeah, I mean, I think when I think of brain, I think of like brain structures and
like physical.
Yeah, and
Yeah.
mind is like, I think maybe like our thought patterns.
Mhm.
And when I talk about mind in the book, it's really our thought processes.
Yeah. No, I was just asking. Someone asked me that. I'm like, I don't know. I'm going to start asking people that. Is there anything else that you think we should talk about that you think is important for the book and for people to help themselves reset their stress level, their anxiety, how to soothe your body and mind in minutes, which is literally in minutes? These are all strategies and resets and buffers that will help you, again, in real time, which is what I love about it. It's not these long drawn out things that will take years to learn. It's like, okay, what am I feeling right now? How can I change that pattern? How can I like focus somewhere else? Which is, again, why I liked it. I really did.
Thank you.
You're welcome.
Yeah, in terms of other things, I just think like life is really hard and we are really resilient, and we need to remember that. And you have the tools within you. Your body is your best pharmacy, and there's so much you can do. And I just want to honor, so many of my clients have been through really horrific things, and I'm repeatedly blown away by how people are able to recover and bounce back, and their future can be so much better than they could ever imagine.
That's that. I love how you just said that, but I got one more question, actually. I'm sorry.
Yes.
There was a woman, I don't remember her name, Abigail, I think her name is. You know, she is Dr. Abigail. I don't remember her last name. And she actually was saying that the worst thing you can do for rumination is to go and just see therapists at nausea, like just constantly, because all you're doing is continuing to focus on the problem or the thing that you don't want to focus on. And that's how people end up overthinking and ruminating, is by going to therapy, especially children, putting children in therapy at a young age. Because if there is an issue, you're just basically telling your brain, like, I have a problem. This is my problem. I have a problem. This is my problem. And like, you can actually overtalk and talk your problem into being bigger.
Right. So I think it's helpful to just realize that different therapies are focusing on different things, and it's not helpful to overgeneralize that all therapies are encouraging rumination. None of the people that are seeing me are ruminating in my office, because it's like, if we talked about the breakup, we get 5 minutes to talk about that if you want to talk about that.
We're not talking about this type of therapy. I was actually asking you more from a child's perspective, for like, I mean, I know you're not.
So I think behavior therapy for kids, like anyone that's focused on cognitive behavioral therapy is aware of, and mindfulness-based cognitive therapy specifically is top of mind, aware that rumination is a problem. And what are we doing? All of these interventions are meant to, what are your goals and how can we get you towards them? It's very solution focused and present and forward moving rather than focused on the past. I think.
So you don't agree? You don't agree with that? I'm going to look for her.
I know who you're talking about. You're talking about Abigail Schreier, and she wrote a book called Bad Therapy.
Yeah, I was going to say Bad Therapy.
And I think it's, I'm sure that if you looked at therapy, some therapists, like the ones I said that are keeping people in their office for 20 years, some therapists might be encouraging rumination. But I think a lot of kids might need therapy, and behavior therapy for a kid that needs therapy is not going to include ruminating. It would include like, what are we going to do? You're anxious about, you don't want to go to school. How do we get you to school? Not overly dissecting why you don't want to go to school and what happened yesterday.
So you're talking more about there's different techniques. Some techniques are just like,
we can't judge an entire field based on one sector. That might be
about, because I did agree with a lot what she was saying for certain cases.
She's not a therapist. She's a lawyer that did.
She's a lawyer?
She's a lawyer. She did an investigative.
Yeah, she talked to a bunch of therapists. Right.
She talked to some.
And it's very. I know it's very. She's very controversial.
And again, I actually know her, and she's wonderful. I I think she's a gifted writer, but I think it's easy to make all or nothing statements, and it's helpful to see that, sure, maybe one doctor did a bad knee replacement surgery, but maybe another doctor would change your life. And
don't paint everybody with the same brush.
No, and there are a lot of adolescents that truly need therapy, and I worry that their parents might have the wrong impression, and adolescents that are doing dialectical behavior therapy are dramatically reducing their risk of suicide. And so I think it's really important to see, like, some therapy is not helpful. I think it's helpful to ask questions, like, what is the difference between therapy and venting? Because in my practice, I deliberately, like, I actually was joking with a client once. This person wanted to talk over and over again about the same thing. Obviously my job is to be genuine and tell someone when there's spinach in their teeth. It's like, we've talked about this so much. We can't, like, what are we going to do to move forward? This already took up so much of your life, taking away our time. Totally. What do you want to do going forward? And the person, like, literally was like, this is my time I'm paying. I'm like, I can't do this. I'm not going to, this is making you worse. From now on, if you want to talk about this, we'll set a time where we'll agree on an agreed upon amount of time to talk about this. And then I'm literally, because I think my face is too, like, reinforcing, I'm going to start doodling on purpose that, like, the rumination has started and we're going to change the channel. And so I think, yes, it's a problem for therapy to be rehashing your upsetting thing with your third grade friend.
There's a lot of integrity in what you said. I think that is integrity based, right? So therapy, so not everyone's painted with the same brush, but that's what you just did with the patient. I think there's a lot of integrity in that. But there are people out there who do stay for 20 years and because they're getting a paycheck and they're getting,
there's enough need for therapy right now. Like, I feel like it's a disservice. People need therapy. I need to create a space for them in my office and graduate someone else to do that.
Absolutely. But but again, like maybe you're in
right. And again, like, this
book,
the way,
I'm just like, I'm just like having a conversation. Yeah. I was actually asking more than my belief. I just don't know. I was saying I heard one person talk about him asking another therapist what your opinion is.
Yeah, and I love talking to you. Yes.
Yeah, I'm just saying. I mean, I saw that it was super. No,
I think it's helpful to draw attention to something people might not be aware of. Like, what is the difference?
I'm a very curious
person.
Love that.
Yeah, that's why you're good at this.
And I like, when I hear something that strikes a chord, I want to, like, deep dive into that and ask other people's opinions. I don't take one person's opinion on it. And you're right. Like, I didn't even realize that she was actually a lawyer. I thought that I know that she did a bunch of, she did a whole investigative report on it and talked to a lot of different people. And that was, like, the general consensus. But I assume that she had a background, but that doesn't mean anything.
Yeah, and I think it's a helpful thing for people listening to think about, because I think oftentimes when we're stressed, we're like, let me call a friend and, like, rehash. And just the same way that rehashing with a therapist isn't going to be helpful, rehashing endlessly with, like, 7 friends or reassurance seeking, what does this mean? What do you think will happen next? So a big thing I talk about also in the book is, like, and we all know, is, like, friends are amazing for stress reduction, but we need to, like, use our friendships as, like, mental vacations and nourish us, rather than, like, bringing ourselves and other people down, which is, like, a perfect thing that I also want to add is, like, the reason to reset from stress isn't just for you, it's for the people around you, because you regulating your emotions is contagious. Like, emotion regulation is contagious. Being able to reset is contagious. Managers that are able to see stress as positive, like, their teams are less stressed. And so we want to reset our stress so we don't need to ruminate with other people or...
No, and it's true. I think that everyone has a vibration. And so if I feel you're at, like, if you're unregulated, I should say, and you're at, like, a 20 on a scale of 1 to 10, it's going to just raise my level, right? Versus if you were more regulated and more calming, right? So I think it's not just for you, it's for the people around you, for your family, not just for your work people, but for your family as well.
Then you feel worse if you, like, took something out, work stress out on a family member, snowball.
And then that's a whole other snowball situation.
So the whole point of this is you don't need to snowball, and actually you could do the opposite. You could feel incredibly proud and feel a sense of self-efficacy that not only was I able to manage, but that spared my kids, like, going through something difficult, and actually created a nice night for them.
All right, you guys, the book is called Stress Resets, and Dr. Jenny Taitz.
Thank you.
I appreciate it. Where do you have where people can buy the book? Where do they find you more information on you?
You can find the book wherever books are sold. And my website is Dr. Jenny Taitz, and I'm on Instagram very infrequently because I really practice what I preach, but Dr. Jenny Taitz on Instagram.
I love that. Thank you, Jenny. Dr. Jenny.
Thank you.
All right, guys. Bye.